This is the second part of the video. Oncology is the shapes 28. Neoplasm or neoplan is a normal and abnormal new growth of tissue. Malignant neoplasms cancer are likely to spread and cause serious illness or die. Benign neoplasms, though, do not spread and are less harmful. When speaking to patients, doctors generally say growth or tumor. You have a small growth or you have tumor is the balance. A lumps or swelling in a collection of tissue or fluids within visible or palpate can be palpate or felt with the fingers. A lumps may be due to an neoplasm, but they are other causes an inflammation or fluid accumulation. Patients say, I have a lump in my left breast. Doctors say there was a foreign palpate mass in the liver. Malignant tumors are characterized by rapid growth and invasiveness. The tumor may invade the local tissue or may spread to distant part of the body, metastasis. Neoplasms, which are the result of metastasis, are called secondaries or as an opposite to the original tumor, which is the primary. We have the results of the scan that now and I'm afraid they show that you have a small ground in the prostate. Fortunately, it appears to be at an early stage, and there is no sign of spreads. So, if we remove it, there is every chance of complete cure. And now to invade birds is to enter and spread out of part of the body. In this process is invasion. Now, if you a tumor is described and invasive, it has the ability to spread. Symptom and sign of malignancies. The symptom of malignant disease may be related to the signs and location of the tumor. For example, a space occupied lesion of the brain causes raised intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumor of the colon may obstruct blood the lumen and cause changes in the bowel cavity. Other possible symptoms of malignancies include bleeding, pain, and weight loss. Case 65. A 30-year-old man present to his GP complaining of pilless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He has been feeling generally unwell and has lost about 5 kg in weight. He has also complained of night sweat. He has no significant past medical histories. Um, Tremor of tumors. A tumor came sometime he completely removement or exercise by surgery. If you this is not possible, for example, if you has really metastasized to other part of the body, it may be possible to destroy it in by radiotherapy or chemotherapy. Seen Unit 42. We, when a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. Neoplasmas, um, oncología. Neoplasma. Neoplasma es una anomalía, es un crecimiento anormal de un nuevo tejido Los neoplasmas malignos, también conocidos como cáncer, entre paréntesis, son propensos a propagarse y causar enfermedades graves o la muerte. Los neoplasmas benignos no se propagan y son menos dañinos. Cuando hablan con los pacientes, los médicos generalmente usan los términos crecimiento o un tumor. Este tiene un pequeño crecimiento, tumor en el intestino o un bulto o hinchazón a una acumulación de tejidos o fluidos, estos visibles o palpables. Un bulto puede deberse a un neoplasma, pero también hay otras causas como inflamación o acumulación de fluidos. Los pacientes dicen, tengo un bulto en mi seno izquierdo. Los médicos dicen, había una masa firme y palpable en el hígado, the liver. Los tumores malignos se caracterizan por un crecimiento rápido e invasividad. El tumor puede invadir los tejidos locales o propagarse a partes distintas del cuerpo, metástasis o hacer metástasis. Los neoplasmas resultantes de metástasis se llaman secundarios en oposición al tumor original, que es el primero. En el caso del paciente, los resultados de la exploración muestran un pequeño crecimiento a la próstata que afortunadamente parece estar en una etapa temprana sin signo de propagación, por lo que existe una gran posibilidad de cura completa. These symptoms and signs of malignancy. Síntomas y signos de malignidad. Por ejemplo, una lesión que ocupa espacio en el cerebro puede causar aumentos de la presión intracraneal y síntomas como dolor de cabeza, vómito, trastornos visuales. Los tumores de colon pueden obstruir el lumen y causar cambios en los hábitos intestinales. Otros posibles síntomas de malignidad incluyen sangrado, dolor y pérdida de peso. Podemos ver el caso 55. Este es la historia de un hombre de 33 años. Acudió a su médico de cabecera quejándose de un bulto indoloro en el lado derecho del cuello que había estado presente durante aproximadamente 2 meses y estaba aumentando de tamaño. Además, se sentía enfermo en general, había perdido aproximadamente 5 kilos de peso. También se quejaba de sudores nocturnos, no tenía antecedentes médicos significativos. No tenía antecedentes médicos significativos. He has no significant past medical history o no tenía algunas historias significativas. Tratamientos de tumores. Un tumor a veces puede ser completamente extirpado o extirpado mediante cirugía. Si esto no es posible, por ejemplo, si ya se ha propagado a otras partes del cuerpo, puede ser posible destruirlo mediante radioterapia o quimioterapia. Esto lo vamos a observar en la unidad 42. Cuando no es posible la curación, se administra un tratamiento paliativo que solo tiene como objetivo aliviar los síntomas. Chapter 29. Pregnancy and childbirth. Childbirth, the expect that day of delivery is the EDD, is the day of which woman is expect to give birth to child she is carrying pregnant with. Is calculated by ending 80,000 day of wait 40 weeks to the first day of the last menstrual period. LMP Childbirth is also referred to by doctors as partirictus. Delivery is the process of helping child to born and a spontaneous vaginal delivery. CBD is a normal delivery. If there are complications, then baby may be delivered by cesarean section, surgical removal. A full-term pregnancy is 40 weeks, divided into 3 trimesters. As baby who is born before this premature and once born after 40 weeks is post-mature, and baby who is born die, for example, because the umbilical cord is around Ignis is stillborn. A pregnancy is made in before term spontaneously with miscarriage, spontaneous abortion, or be deliberately terminated with an induced abortion, termination of pregnancies. Note, the verb induce means to cause something to happen. Labor, the process by which the fetus and placenta are pushing off the uterus is called uterus is called labor. It is divided into four stages. Some words with are combined with labors are premature, prolonged, spontaneous, induced, false, and labor. Presentations of life. Fetal lies in the position as a fetus is the uterus. The normal life lead is longitudinal, and the abnormal lie is transverse. Fetal presentation refers to the part of the fetus which occupies the center of the pelvic canal, in which the examination fingers fail of vaginal examination, butterwort. The normal presentation is with the head better presentation, great presentation with the bottom are presented. Braid is old word for buttons. A normal presentation may require delivered with forceps. Entity, the respiratory system. Couch, a common symptom of upper respiratory tract infection, UTI, and lung disease. A couch may be produced where the patient coughs unsputum or not productive. Where there is no sputum, a productive couch is often described as a non-productive couch drive. Sputum of lane may be clear or white, mocking, yellow due to presence of pus, purulent, or blood stain. Hematitis. A doctor is examination a patient um, a patient who is complaining of a count. Doctor, how long have you had the cow? Mr. Hamilton, of 4 years. Doctor, do you smoke? Mr. Hamilton, I used to smoke heavily, but I gave up years ago. Doctor, do you call up any phlegm? Mr. Hamilton say, yes. Doctor, what color is it? Mr. Hamilton, usually yellow. Doctor, have you ever noted any bloating? No. Hamilton say, Doctor, any problems with your breathing? Mr. Hamilton, yes, I'm getting very short of breath. I have to stop halfway up the stair to get my breath back. The doctor's why is the patient case now? Dysphonia and causes purulent sputum for years, no hematosis. No, the nose blend is pronounced phlegm. Phlegm. Auscultation. The doctor is examining is Mr. Hamilton chest. Take the breath is out through your mouth. Good. Now say minutes mine. Minutes 99. Listen to the chest with a stethoscope may reveal the presence of sounds apart from normal breath sounds. There are two main kinds of other sounds. Crackles, which sound like hair being rubbed together and soldiers. The presence of fluid is the lounge. Whistles were more musical sounds like wiggly and indicating narrowing of their airways. The sound of asthma patient breathing is also called whistles. Whistles. The sounds here with the pleural surface are inflamed in a pleurisy is calling a pleural rams. The doctor asked Mr. Hamilton to say 99 to chest vocal resonance. We may be increased on a pneumonia or disgrace on a pneumothorax. After examining Mr. Hamilton, the doctor understood this now. Chest early respiratory crackle, brown lost base, respiratory whistles. The skin one. Some type of skin lesions. Medical term, common word and feature. Medical term, muscular spots, no raised above the surface of the skin. Papular spots raised above the surface of the skin. Nodal, long, large pupillary, vesicule, small bleeder with fluid. Boas, blister, a larger vesicles, pustules, cam, dry blue, exhales, other surface of the skin, scale, a thin layer of epidermis separates from the skin, cicatrice, scar, a mark of the skin after healing, a pleural cicatrice, Nibus pit marked a colored skin lesion present at birth. Fleashing nervous smallest raised brown nervous bear were not produced by HPV fruited by enlarged pupil of skin access. Now the liquid, often yellows, formed as a result of infection is pus. If your lesion is pustular, is it filled with pus? Ration, a single skin lesion can be regular or irregular in shape. When there are many multiple lesions, especially muscular or purplish, the result is ranks or spot is common language. For example, the ranks of an infection disease shows as a rubullet, a rash is said to erupt or break out. My little boy has broke out, is part or is a rash all over his body. The following features of skin lesion are usually noted: location, scene, shape, color, type. For a rash, note also distribution, wide braid on many parts of the body or localized or one part only. Groupie scatter more or less evenly spread out or clutter small group. The skin too. Injury to the skin. Here in extract from a medical website. Mentioning injury to the skin are divided into those caused by sheer force, so as a knife. Injury from blast first abrasion, also called graze of stress in superficial surface injury involving only the epidermis, which has been removed by friction. Swell is linear, is a feet, general scratching, where grace involving which area in abrasion caused by drawing part of the body over a round superfice. A contusion, also called bruise, injury that occur while blood vessels in the skin are damaged. Laceration, also called tear, is wound involving both the dermis. Epidermis is usually distinguished from penetrating in or incisive both by its irregular age and agents and relative lack of bleeding. Injuries from shear force, an incision wound, also called a cup, is breaking in the skin where the length of the wool of the surface is greater than the depth of the wool. For example, a groove caused by resin blade. The depth of penetrating wool is greater than the superficial length of the groove. For example, stab wound caused by knife. Case report. Read the case report and compare it with the illustration. Cause 2. An 8-year boy present to the accident in the emergency department after he stumbled and fell while running is a groove. He has received a blow to the hand from a rock and have been scratched by bushings. On examination and vertical laceration, 1 centimeter long was north of the breeder. It is now just right of the middle line. There were a number of superficial scratching of the right side of his forehead. His right upper line was mildly contoothed. Sore. The word sore is a popular term for many different kinds of skin lesion, especially infect lesion. A pressure sore is a skin ulcer caused by pressure, for example, the pressure of lying in bed for long periods, also known as before bed sore or the excluded ulcer. And cold sore is a lesion caused by herpes simplex. No, the adjective sore means painful, for example, throat draw. Tipos de lesiones, la piel 2, tipos de lesiones mecánicas en la piel. Las lesiones mecánicas en la piel se dividen en dos categorías: lesiones por fuerzas de romas contusas, abrasión, también llamada rosadura o rasguño, lesión superficial que involucra solo la epidermis removida por fisión, contusión llamada moretón, lesión que ocurre cuando se dañan los vasos sanguíneos en la piel. La lesión por fuerzas constantes, laceración también llamada desgarro, herida que involucra tanto la dermis como la epidermis con bordes irregulares y poco sangrado, heridas incisas también llamadas cortes, rupturas en la piel donde la longitud de la herida en la superficie es mayor que la profundidad. Herida penetrante, la profundidad de la herida es mayor que la longitud superficial, como una herida de arma blanca. Características claves: las abrasiones y los cortes superficiales involucran solo la epidermis. La constitución dañada, los vasos sanguíneos en la piel, laceración y heridas penetrantes afectan tanto la dermis como la epidermis, y las heridas incisas son más anchas en la superficie que profundas. Aquí vemos un caso clínico de un niño de 9 años que que acudió al servicio de emergencia después de tropezar y caer mientras corría por el bosque. Sufrió un golpe en la cabeza por una roca y rasguño por los arbustos. En el examen se encontró una laceración vertical de 1 centímetro de longitud en el puente de la nariz junto a la derecha de la línea media. También habían varios rasguños superficiales en el lado derecho de la frente. El párpado superior derecho estaba ligeramente contuso, tipo de lesión cutánea, laceración, heridas con bordes irregulares que afectan a la dermis y epidermis, rasguños superficiales, lesiones que involucran solo la epidermis causada por fricción, contusiones, lesión que ocurre cuando se dañan los vasos sanguíneos. Los vasos sanguíneos en la piel y definición clave. También generalmente términos generales o populares para referirse a tipos de lesiones cutáneas, especialmente las infectadas. Úlcera por presión cutánea causada por la presión, como se produce en esta mucho tiempo en cama. Esta se produce al estar mucho tiempo en cama. Herpes simple causa las ampollas o herpes labial en resumen. O note. El caso describe las lesiones sufridas por el niño, incluyendo una laceración, rasguño superficial y una contusión, y proporciona definiciones claves sobre diferentes tipos de lesiones causadas por herpes simples. 33. The urinary symptoms. Urinary is formed in the kidney, started in the bladder until it's passed or voided. Patient may say, I have some pain when I pass water or pee. Doctor may say, are you having any trouble with your water work? Doctor, are you having any trouble with your water work? Mr. Jones, well, I don't seem to have to go to the toilet more often than I used to. Doctor, how often is that? Mr. Jones, it depends, but sometimes it's every hours or even more often. Doctor, how about at night? Do you have to get up at night? Mr. Young, yes, nearly, away 2 or 3 times. Doctor, do you get any burning or pain when you pass water? Mr. Young, no. No, usually. Doctor, do you have any trouble getting started? Mr. Young, no. Doctor, is the strain normal? I mean, is there still a good strong flow? Mr. Young, preheard, not quite so good as it used to be. Doctor, do you ever lose control of your bladder? Any leaking or dribbly? Mr. Young, well, preheard a little dribbly from time to time. Doctor, have you ever passed blood in the urinary? Mr. Young, no, never. Common urinary symptom and they definition. Frequency, frequent pass of urine. Yeah. Dysuria, burning of scaly pain in the uterus when passing urine. Nocturia, urination at night, and urgency, urgent need to pass urine. Hesitancy, difficulty starting to pass urine. Urinary incontinence, involuntary passing of urine. Hematuria, microscopy, blood in the urine. Urinalysis is the analysis of urine. Simple screening tests of the urine are carried out with rigor. Strive, for example, clinic tests for the detection of glucose. More detailed tests are carried out in the laboratory of specimen of urine. Typical specimens are midstream specimen, MCUs, and catheter specimens CSU. Microscope examination may reveal the presence of red blood cells, pus cells, or cats are solid bodies formed by protein or cells. Plus signs are used in case note to indicate a normal finding. A small almost plus is described as trace for a larger almost plus. The word grow and a market can be used, for example, grow hematurias when there is nothing. The word nil is common. It's common. Sugar nil is common. Protein is plus, blow is plus. There was no sugar. A stray of protein is grow hematuria. And the last chirp of the for that video is basic investigation. Ophthalmoscope. Ophthalmoscope allow the doctor to examine of part of the eye, the iris, lens, retinal, and optic disc. For best result, the examination is done with dimmed or lower line to allow the pupil to examine the light of light. And a topical mediastinal solution may be applied to the eyes to aid dilatation. The patient is then asked to fix it or started for the duration of the test. Blood pressure. A physiomanometer, air pies, a stethoscope, hair pies, bell, diaphragm, pulse, cuff, bulbous, gauze. An stethoscope is used to hear the sound of the blood rushing back through the artery. The first thumpy sound is the systolic blood pressure (CBP). When the thumpy sound is no longer heard, that the diastolic blood pressure (DBP). Taking blood during venipuncture, the phlebotomy, as technician who takes blood, insert a needle into a vein and withdraws blood into a specimen tube. It is sent to the hematology laboratory for analysis. Usually, the phlebotomy can find a vein in the inner part of the elbow, the antecubital fossa, that is easy accessible. She may apply a tourniquet, a tie bath, able the of the patient may be asked to collect their hand to make a first, in the other make the veins more prominent. After guard, the patient may be asked to press lightly or dresses, usually a piece of gauze, to help the blood to clot and to prevent swelling and a hematoma, a black blood mark of bruises where the vein was punctured. No, a bruise is a specific mark. Bruises can be used to describe a number of bruises or larger areas. The patient exhibited bruising of the right foot end. Investigaciones básicas, oftalmoscopia Oftalmoscopía. Oftalmoscopia es un examen que permite al médico visualizar estructuras internas del ojo como el iris, el cristalino, la retina y el disco óptico. Para obtener mejores resultados, se realiza en un ambiente con luz tenues para permitir la máxima dilatación de las pupilas. Puede aplicarse una solución midriástica tópica para facilitar la dilatación. Se le pide al paciente que fije la mirada a un objeto durante el procedimiento. Blood pressure, medición de la presión. Aquí vemos que se utiliza un esfigmomanómetro, un estetoscopio para medir la presión arterial. También la presión sistólica, que sus siglas SPP, primer sonido del bombeo, indica la presión cuando el corazón se contrae. La presión diastólica, DBP, punto en el que desaparece el sonido, indica la presión cuando el corazón está en reposo. Extracción de sangre, venopunción. La venopunción es el procedimiento mediante el cual un flebotomista o un técnico especializado en toma de muestra extrae sangre de una vena, generalmente en la parte interna del codo, fosas antecubital, que suele ser fácil y accesible. Paso del procedimiento. Localización de la vena, se elige un punto adecuado para la extracción. Uso del toniquete, se coloca una banda ajustada sobre el sitio para hacer más visible la vena. Paciente hace un puño. Esto ayuda a resaltar la vena para una punción más efectiva. Inserción de la aguja, se extrae la sangre en un tubo de muestra que luego es enviado al laboratorio de hematología para análisis. Presión sobre el sitio, se coloca gas y se pide al paciente que presione suavemente para facilitar la coagulación y prevenir la hinchazón o la formación de un hematoma. Un hematoma, moretón negro o azul en la zona de la punción. Nota lingüística. Bruise es moretón en una zona específica y bruisings with ing se usa para describir múltiples moretones en una zona extensa afectada. And goodbye.